Okay, so this is scale 35.1 procedural guideline applying a fecal management system. So the first thing you want to do is you want to make sure you have the doctor's order. You also want to, when you enter the room, you want to introduce yourself, perform hand hygiene. You want to identify the patient with two identifiers. You want to ask them if they have an allergy to silicone. You want to explain the procedure, explain what you're going to be doing, let the patient know why we're inserting this into their anus and the purpose of it. And if they have any questions, answer any of their questions. And then you also want to ask the patient, like, how frequent are they having loose stool or diarrhea? And then you want to apply clean gloves, and then you want to assess the patient. So you want to raise the bed up to a good working height. Of course, you also want to make sure you have all your supplies with you. You want to assess the patient, the anus, assess the skin around, and if you need to perform any peri-care, or you want to make sure the site is nice and clean before you do anything. Also, you want to assess if there's an impaction as well in the anus and in the rectum. Once you've done that, then you want to remove your gloves, wash your hands again, and then put on new gloves. And then you want to prepare the fecal management system. So first you're going to connect the collection bag to the catheter tube. I don't really have anything to demonstrate which goes where, but once you connect that, then you want to make sure that the cuff, what's actually going into the anus, make sure that that's completely deflated and that there's no air. You want to do this by there is a syringe that comes in with the package. Use that syringe to deflate any air that's in that cuff. And then once you've done that, remove the syringe. Then you want to fill that syringe with water or normal saline, and depending on what the system recommends, if it's 45 mLs, that's what I seen in a couple videos I watched. Then you want to connect that syringe back onto that port, because there's usually two ports. There's the port that you use to fill the balloon, and then there's the irrigation port. And you want to fill it up to the one that will fill the balloon. Connect that, and then the patient would still be in the left Sims position. If they can't tolerate that for some reason, then we'll adjust accordingly. And then after you've done that, then you want to make sure that you do lubricate the cuff, lubricate it. Also, it would help to lubricate the anus. You want to just also talk your patient through every step you're doing. Let them know what you're doing, because obviously they can't see you as well. So once you're going to tell them to take a deep breath, everything's all connected, and you're going to insert the catheter, the tube, up into the anus, until you feel it's comfortable. And usually on the catheter there's an indicator line, and you want to stop at that indicator line. And then once you've done that, then you want to fill that balloon with the saline that you have in the syringe or the water. So you would just push slowly, slowly, slowly. Ask the patient how they're doing, if they feel any pain, any discomfort, and depending on what brand the fecal management system is, usually there's a little circle, and that part you're going to fill and fill, and you're going to be looking at that, and usually it'll pop, and that's when you know that it's placed in correctly. If it doesn't pop, you want to keep inserting, but you don't want to fill it more than what the recommended mLs is. Okay, so once you've done that, you want to just not pull on the catheter, but you want to just tug slightly just to make sure it's in place, and also keep a look at that indicator line as well. So once you've done that, then you're going to change your gloves, wash your hands, put on new gloves, um, and then you're going to take the collection bag, and there's usually, I don't know what it's called, but uh, something that you can use to connect it to the bed frame, because you always want to hang it lower. So you want to hang that on the bed frame. You also, once you've done that, you're going to have to turn the patient back over. So you want to make sure that they're not laying on the catheter itself. Um, so you want to have them lay flat or elevate their head, but make sure that the catheter is actually in between their legs and it's free flowing. And if need be, if you need to collect a stool sample, you'll use the port that's there. And while you're doing this, assessing the patient, how they're doing, assessing the catheter, make sure it's working properly, that the loose stool, the diarrhea is flowing through into the collection bag if need be to change it. Assess that, the color, what the consistency, also the amount, the INOs especially. And then you lower the bed, remove your gloves, perform hand hygiene, make sure the patient has a call light, ask them if they need anything. Also, you could also go ahead and do an assessment on their abdomen, listen to the bowel sounds, do that as well. And to remove it, obviously you want to perform hand hygiene, let the patient know what you're doing. You want to also put them back into left sims position. You want to have a syringe, and you want to put that on that port that you used to fill the balloon, and you'll deflate it and deflate it. And then once you do that, you want to slowly pull out the catheter. Ask the patient how they're doing. If slowly pull it out, and you want to discard of that. And also document everything you've done. Document how much was in the collection bag. Also document how much you pulled out from the syringe, how the patient tolerated it. I believe that's it. Um, and also one other thing is you want to also document the, the skin around that area before anything, and then make sure always your bed is in the lowest position. Make sure that the side rails are up, the necessary appropriate side rails are up, that they have their call light, and ask them if they need anything. Perform hand hygiene, and pretty much that's it.